And Dr. Tara, do you also see a role, or how do you, in addition to talking to the mothers, do you also try and bring in, I know culturally fathers are not always involved, but, do you try and bring them in or make them aware about the possibility of postpartum depression? And do you pretty much always see the signs before? That's my other question, if
Yeah.
you're.
Um, we encourage the mothers to come with the husband and right from the antenatal period we make the husbands involved in the antenatal care and
Mm,
discussion about the birth process, and husband sits in the labor ward. We
mm,
allow the husbands to be, in case she needs a surgery, they come into the theater. And once they are involved from the beginning, and
mm,
sometimes they themselves are able to tell us, like, she's more anxious now. As
mm.
the date is coming nearby, she's more anxious. So we involving the father, the spouses, it really helps us. But sometimes we have this difficult cultural barriers, like,
Mm, mm,
mother has to be there, mother-in-law has to be there. So I tell them all three come together. Let's sit and talk together. So I go into a doctor's chamber, sit and talk across, because I think they need to vent out whatever they feel. Sometimes the mothers and mother-in-laws feel isolated. They are only taking decisions. They are only involved. What do they know? When do we come into the picture? I said, please come, let's talk. And this is what we are thinking. This is what the birth process is. I feel involving them, then they have a lot of confidence and they help us to understand what the woman is going through. And that becomes easier for us to take care of her, I feel.
right.
Yeah.
Okay. Yeah, I guess it is, if not a village, at least a family affair in an Indian context. So,
And may I add one more thing, Aparna? There's a study from Toronto by Dr. Kaveri Dasgupta who has shown that that hu- husbands of women with GDM or partners of women with GDM, they can develop diabetes because of the mother's GDM, because they are, again, like you said, stressed out and very worried about their wives. So it's also probably will help them in the long run if their anxiety is allayed and they're taken care of. So I completely agree that we have to bring all of them in and calm them down. Yeah.